this is the picture of the sundial, and I brought it forward as we move towards recentering. There's so much that has happened to us in the last year and a half, 2 years. And we always think and value community voice as building our knowledge together. But the Sun Temple here in that first image on the first slide, as well as our agenda, is really from the Mesa Verde from the 1200s. There with the Mesa Verde people in the Four Corners area brings together many communities where they found shells, where they found copper. There was lots of trade. We know our continents were connected. And also in China, there's Chinese sundials. We also know in the African American community, African community globally, there's been sundials, for example, found with the Egyptian. The Nahuatls, the fifth sun, and the Aztec stone sun has been critical in terms of connecting the medicine and really guiding peoples throughout many, many centuries. They borrow also from the Mayan glyphs. So I recognize all peoples today. So as we think about that, recognizing and including all peoples, we want to find solutions. Our TREE Center, it's a national research center funded by the Minority Health Disparities. We are a second generation research center of excellence. And it started in 2010. I want to recognize Dr. Steve Verney, Dr. Matthew Borrego, Dr. Maria Braveheart, and those of us who had worked on the first center. And this is critical, as well as Dr. Nina Wallerstein, who's with us today. We started in 2010. Next slide, please. The focus of this center was to actually build research with, not on, but with communities and by scholars of color. Next slide, please. And to change the terms and conditions in which we do research. As an academic institution, it's a white medical school with history. Yes, it is on Native lands, but there are challenges to engaging with community partners in terms of organizational challenges, whether that be space, operations, or belief systems and attitudes that undermine advantaging, power sharing, and trust building. This was from our P20, our Community Engagement Core here, Clarence Hogue, Lucinda Cowboy, Allison McDuena, Nina, who worked with us, Matt went out with us. We decided if we were going to engage with communities more deeply, we needed to change the terms and conditions. So we started place-based engagement then and developed tools with communities. Some of them you'll hear this afternoon that actually benefited setting specific bi-directional communications and trust. Next slide, please. These tools are available there at that website. Moving forward, the vision of our next Disparity Center was set in a closing ceremony as well as an opening, as you see in the top right and the bottom of this, in which we had a vision to actually focus on improving the conditions for behavioral health and health equity for our diverse communities in New Mexico. We came together with the vision that together we are stronger, and to build our assets and strengths for the benefit and good of all. That knowledge building is not just about self-promotion and publishing, it's about social change and healing. Next slide, please. So this vision became a reality. We are one of 12 centers in the nation. Over 131 applications went in and we were selected. This is an honor. $7.2 million. If we can go to the next slide, please. Thank you. I want to highlight that the NIMHD was founded as part of the Affordable Care Act and health reform. It was elevated to the level of an institute in the National Institutes of Health. And this is their multi-level framework for thinking about the causes as well and influences on health disparities and health equity, as well as the interventions. Those I have circled are much of what the areas in terms of the levels of influence collectively our tree center focuses on in building science with teams and with community partners. Next slide, please. So we have 4 aims. We have a co-leadership model. Our goal is also to operationalize integrated theories of historical trauma, intergenerational grief, and in healing, as well as community-based participatory research, tribal participatory research, intersectionality theory, and thinking more deeply about interventions that will advantage the social determinants of health. We are also invested in building the next generation in a scientific workforce and fostering and cultivating the capacities of underrepresented minority investigators as well as early stage investigators. We also are cultivating and building trust with community and tribal stakeholders and thinking about how we translate and disseminate these findings into practice. Next slide, please. So I'm just going to briefly go here because we're about out of time and I want to move to the evaluation. But the co-leadership model rather than top down, and it's a challenge, but we want to have a practice in which we're building on each other's differential assets and different strengths. So the helix here really represents the interconnectedness of our administrative core, our community engagement core, and our investigative development core, as well as the 2 major research projects led by 2 scientists with their community partners, and that this Community Scientific Advisory Committee, which is the purpose of this meeting today, and the communities of practice, the larger network in New Mexico, as well as tribal and national partners, are all critical to achieving our goals. We couldn't do it without the expertise and administrative and operational support. We will have a new member join us. Janae Martinez will join us October 11th as a senior program manager, and she can post her name in the chat and her email. Next slide, please. I want to highlight that also as part of the vision and understanding more deeply the roots of our tree, the historical and deep context and colonization, genocide, and historical trauma within our diverse New Mexico communities. But we think about the multiple domains of influence in terms of the tree trunk and those multiple rings that we work intersectionally across. And then, of course, as we build our science, we translate that into infographics and understanding more deeply so that we can have shared understanding about how we find solutions together. This is a quote by Dr. Avila, who's with us today. She says, visually, the tree is real and embodies theory and traditional knowledge with communities. It's become an organizing force and vision for interconnectedness. And of course, the biggest part of it is the branching out in terms of applying to policy, practice, and systems change. Next, please. I want to highlight our intergenerational cultural knowledge, suicide prevention, a major partnership with the San Felipe community and tribe, led by Dr. Alshel and Dr. Fink, Esther Tenorio, and many more who are on the call today. But again, centering the voice and the knowledge of the San Felipe community. Next slide, please. The next major research project is led by Dr. Jessica Goodkind with a very impressive and another largely engaged centering community voice with immigrant rights organizations in New Mexico to advance Latino immigrants. Next. Finally, we do have innovations that we've achieved over the years since we launched in our vision. We have organized ourselves around knowledge clusters, really building on pollinating and growing our collective ability to impact change through publications, through cross-sharing, through bidirectional understanding of how we understand interventions from various nuances. Next slide, please. And another innovation and advantage of having a center is to be able to write supplements together as teams. We had a special supplement focused on Alzheimer's and cognitive decline and the structural determinants of cognitive decline. We also have an existing supplement focused on analyzing large-scale policies across all states and social vulnerabilities. Blake Broussard is with us today. Dr. Yi-Lang Zhu and Carlos Linares has been working on this project. I want to address, and she's not able to join us today, Dr. Sanchez Youngman is building her career development as a Latina Chicana from New Mexico, working with communities around suicide prevention. And then I'm just going to end here shortly with the next slide, please. Other highlights is about the pilot projects, investigator development core led by Dr. Teresa Cruz, Dr. Matt Borrego, Dr. Janet Page Reeves. Look at all of you who are on with us. We've had over 16 pilot projects so far. These are innovations. They're observatories for creating new knowledge and inspiring with our communities partners for really building interventions. We hope and we want to have many of these pilot projects move on and join us for the Third Generation Center. They will, some of these pilot project PIs will be sharing their insights this afternoon. Next, please. And then as we think about engaging with communities, we have other innovations. We have the Ignite for Equity talks that we launch, in which people talk about their own experiences in behavioral health and interplaying evidence with practice and healing. We also have launched an Equity and Policy Institute. This is a new and an innovative way to bridge community partner knowledge with policymakers and scientists and scholars. And we have launched this over the last year during COVID. We have 14 teams, and Dr. Jalen De Maria is working with me with additional monies from the Kellogg Project with 6 teams across the state. Some of you are on the call in terms of creating digital policy stories. We will have a policy dialogue again coming up where they will feature and they'll be sharing their work. Next, please. And finally, that's just a little bit more, and that's the list of all the various teams focusing on racial justice and equity issues. Next. And as we move forward, we do know, and we've all been very mindful, and many people have experienced mass grief and trauma and hardships due to COVID, but we are, as a center, collectively committed to going deeper and understanding the legacy of human rights, and also about the mistrust of COVID and the impact on our rural and diverse communities. We also know it's been a hardship for our underrepresented minority families and their own communities. There's more need for data sharing and transparency. Next, please. So when we decided as a center in March 2020, we decided to launch with the lead of Lorinda Balone and Magdalena Avila, Karan Katura, and many others that will be on the panels this afternoon, to just really find out what's happening with our communities. Of course, there's been fear, depression, isolation, grief, loss, many families fearing and not feeling safe, particularly immigrant communities and rural and tribal communities. Next, please. Especially African American and Asian Pacific Islanders as well. But there's hope and acts of kindness, as Dr. Ross Padilla talked about. These were some of the feedback. Delivering packages of food at people's doorways, traditional healers bringing medicine to the people, and working on self-care. Some communities have sending love letters to their elders. Next. As we think about the day, please remember that as we move towards a path forward, we all went virtual. So the Tree Center, we collectively launched an e-webinars dedicated to resiliency, moving forward towards healing, and co-sharing our deeper understandings about our distinct legacies, but shared histories. We had a special discussion and dialogue with Dr. Braveheart, Dr. Begay, and Ryan Sanchez on microaggressions and American Indians, Alaska Natives. We also had a special talk by Dr. Zinzi Bailey on structural racism, and our fireside chat brought together many, many insights around intercultural leadership and the importance of that at this time. Finally, next slide. We have a Weave New Mexico project that we have applied for, and we received the funding. We're one of 21 states in the nation for looking at vaccine equity. This is in collaboration for the Center for Native American Health, Dr. Jassy Parker, and Center for Participatory Research, Dr. Wallerstein. It also brings in many researchers with the Tree Center. Please stay tuned because we're going to be sharing in the spring some of our data analysis and findings across different place-based efforts in diverse communities with digital stories, catalyst films, and a statewide survey. Next, please. Moving ahead, what will the third generation center look like? We can't afford to do business as usual. We must think about what anti-racist research means during a time of COVID, post-COVID, but in terms of advancing our community's health, we must center community voice, particular communities that have been oppressed and marginalized by mainstream white supremacy, and shift the power by changing and continuing to change the terms and conditions for building trust and building science together. As we move forward with this last slide, I just want to end with this thought. Next slide, please. Our future direction, what you hear today, how can we think about couching and transitioning more as we grow anti-racist health research, centering the voice of marginalized communities, and also framing our research so that we change the narratives, that we create effective policies and systems interventions, and we use voice and storytelling as a legitimate way of knowing. Thank you.